Hello and welcome to today's webinar, TuneUp Digestion to Optimize Energy. Today's presenter and creator of the 10-Point TuneUp series is Dr. Jacob Teitelbaum. Dr. Teitelbaum is a man who seems to have endless energy for what he does and helping others live their best life. Given how much he has accomplished, you may never guess that he was diagnosed with fibromyalgia during medical school and overcame the limitations of this condition to become internationally known health enthusiast that he is today. From his days as a hospital physician providing free medical care to a homeless shelter, to authoring 6 books and lecturing around the world, he has dedicated countless hours to helping others on their journey to wellness. Dr. Teitelbaum is a board-certified physician in internal medicine and was a founding diplomat to the American Board of Holistic Medicine. He is an expert in the field of chronic fatigue syndrome, fibromyalgia, and sleep, on which he has authored the books The Fatigue and Fibromyalgia Solution, the best-selling From Fatigue to Fantastic, Pain-Free 123, A Joy, the Beat Sugar Addiction Now series, Real Cause, Real Cure, and the popular iPhone and Android application Cures A to Z. The 10-Point TuneUp program was designed by Dr. Teitelbaum as a checklist for healthcare practitioners to quickly and easily address key systems biological imbalances. These crucial underpinnings are the pearls from years of treating conditions of fatigue. Just some housekeeping before we begin. Participants will be on mute to minimize noise and distractions during the webinar. But please submit any questions that you have for Dr. Teitelbaum through the GoToWebinar chat box on your screen toolbar, and we will try to answer as many as we can at the end of the presentation. Thank you. With that, Dr. Teitelbaum.
Welcome, everybody. So we're going to have a fun day today. We're going to have 2 key areas that we're going to discuss. Number 1, there's a paradigm shift going on that's very important, especially for those of us in natural and holistic medicine. What we're seeing is the dinosaur of doing the yearly checkup, which basically was to go to the doctor each year to see if you had it yet, it being some very expensive to treat deadly profitable illness. And over the last several years, study after study after study have shown that most of the screening tests done in the yearly checkup have caused more harm than good. What remains is checking blood pressure, blood sugar, colonoscopy every 10 years, and glaucoma checks. But outside of that, checking for the eye pressure, outside of that, all the other ones have been brought into question and more or less often quietly buried. So we have a new opportunity here. It used to be people went to the doctor and they never felt better for having gone. Maybe they felt relief of not having something. But we're going to teach you today the beginnings of a program called the TuneUp Docs program, where in a simple 1-hour visit, and we'll supply the tools and all the information needed, you will be able to leave people feeling fantastic. And there's going to be, and Carl will tell you about, a simple 60 to 90 minute online training that you can do at your convenience. It's a free training. This is a gift from Douglas to you, that will make you an expert and give you the tools you need to make this really simple and get you on a free referral list that will send people to your practice for tune-ups, and this way help to build your practice as well. So this is going to be a wonderful opportunity. Today we're going to focus on the digestion, which is one piece of that process. Now, by disclosure, again, my simple goal is making optimal vitality available for everybody and empowering the public. Because of this, I don't take money from any drug or pharmaceutical companies, and any royalties that I'm paid go to charity. So even for this, Douglas pays any money they send me 100% goes to charity. So I'm here to give you the information you need to make you an expert healer and to do it in a way that you don't burn out, because you got to take care of yourself also. So that's what this is all about today. And this is for you. Now, when you do the TuneUp Docs training, and you're going to find it's really a wonderful training. In 5 minutes, you'll learn how to optimize digestion. 5 minutes, you'll learn how to optimize sleep. Go through the hormones, including thyroid, adrenal, estrogen, progesterone, testosterone, how to optimize energy, how to optimize mood, eliminating discomfort, and optimizing heart function. Each of those, you'll have thousands of hours of studies and research that's been synthesized into very simple, clinical, easy to do things that you can apply immediately. So you'll go through each of those things. Thyroid, how many of you get really confused about thyroid? We're going to make it, it's kind of like thyroid for dummies, or thyroid made simple. Same with adrenal. These things can be made very simple. The reproductive hormones, optimizing energy is easy. So you can find yourself really being able to help people in a way that's simple. So for today, we're going to talk about predominantly digestion. And digestion, even though it's a very complex area, can be very easy to understand if you simply think about what's going on in each stage and what's important. So there are 3 key areas for optimizing upper digestion. And there's several, just a few for lower digestion. And when you do that, everything will pop into focus. We're going to walk you through that today. You're going to be an expert at having people feel great. For lower digestion with the bowel, you're going to be looking at balancing candida, bacterial, and other balance. We're going to talk about how to tell if candida is an issue by the sinus issues. But I want to start with a few happy thoughts. Many of us have been given the impression in holistic medicine that being healthy means giving up everything that's pleasurable. What an utter load of nonsense. What kind of being that created the universe would create us in a way that says everything that feels good is bad for us? That would be some cruel, nasty monster. That's just not the way it works, whether it's evolution or whether it's by design, however you want to look at this, that things feel good to us. Our bodies and psyche's way of saying that it wants that. And because the food industry has learned to trick that, that's where the problem comes in. So, for example, study after study has shown that chocolate is a health food. If you eat chocolate, it's associated with dramatic benefits in heart health, cognitive health, mood health, and a host of other areas. So there are many myths, and we'll talk about those elsewhere as well, that have been busted. A lot of what we've taught in standard medicine is really kind of nonsense. So the key thing for nutrition is cut out the excess sugar. That's really the main thing, because food processors dump 140 pounds of sugar per person per year, 18% of our calories, into food processing to cover the fact that the food that they're giving us is garbage. And then have common sense, eat whole foods. There's no single diet that's best for everybody, and I suspect that's why there's such a wide diversity of food out there to choose from. So see what your body wants, and then see how is that working out for you. How does it feel? Many people have food sensitivities from the diet, and that ties a lot into fatigue, but it also ties right into what we're going to be talking about today, which is digestion. Now, digestion and energy are integrally related. Getting optimized nutrition is critical, and that's all part of the nutrition, ties into vitality. But what most people don't realize, or in public, and what holistic doctors are really getting clearly now, is that immunity is tied very strongly to gut health. And if your gut ain't healthy, it's kind of like in the old movie where they said, if mama ain't happy, ain't nobody happy. Well, if your gut's not happy, you ain't going to be happy either. So we're going to talk about how the immune system also ties in. And this is all going to turn out to be really simple. So how common are digestive problems? Well, 1 out of 4 Americans conservatively, it's really probably much more than that, have digestive problems, with even constipation causing 2 million hospitalizations a year. This is really a common thing. Most people who come into your office are going to need help optimizing digestion. So we talked about there being 3, or you can look at it as 4 key components to optimizing upper digestion. This is a take-home note right over here. The 4 key components are chewing. You'll see that a big percent of digestion occurs in the mouth before you ever swallow. And that's why take the time to actually taste and chew your food. Side benefit of that is that you're going to get satisfied sooner and people will lose weight that way. But once you get to the stomach, 3 key things. Remember these. It's stomach acid, enzymes. That's what digests your food. Now, you talk about bile also, but almost nobody has bile deficiency. It's mostly acid and enzymes. And then the next question to ask yourself is, how does the stomach itself keep itself from being digested? The stomach is really kind of a big piece of meat, and you would think that the stomach acid should digest it, and it does, except that the stomach is constantly pouring out a mucus lining that protects itself. So again, stomach acid, enzymes, and stomach protective lining. Those are the 3 keys to optimizing upper digestion. So let's take a look at why we're seeing this increase in indigestion. Well, the main reason is that food processors learned several decades ago that the enzymes naturally present in food cause the food to ripen. And if they destroy those enzymes, which is easy, then the shelf life becomes very, very long and you can ship food all over the world. That's why an ear of corn may have a shelf life of 5 days, where a box of cornflakes will have a shelf life of 5 millennia. But here's what they didn't realize or didn't care about. Most of the enzymes that digest the food we eat are present in the food itself. In medical school, we're taught that the salivary glands and the pancreas and perhaps the liver and a bit the stomach, that our body is making the enzymes to digest food. That's wrong. They make enzymes to top off what's already present in the food, but by themselves, they're not able to make enough to adequately digest the food. So when you don't have digestive enzymes, because they're destroyed in food processing, that food becomes indigestible. And after it's been sitting in the stomach for an hour, your stomach says this food isn't digestible, and it hits the return to sender button. And that's what's going on. Now, the other thing is that you need stomach acid. And that's why people have more upper digestion symptoms as they age, because they make less. Normally you'd think that if it was because of too much stomach acid, they would have less indigestion as they age, because we make less acid as we get older. But instead we have more. It's because inadequate stomach acid. So inadequate acid, inadequate enzymes, inadequate mucus lining. Those are the big 3. Remember that, and you're going to be able to take care of most people's upper digestive issues. Now, we talk about you don't have enzymes, that causes poor digestion. Then we're giving acid blockers, which knocks out the other leg of the digestive process. The way we treat it in standard medicine is utterly insane. Why? You look at acid blockers. If we had this data today, they would never have been approved, one hopes, by the FDA. But you see, acid blockers cause as much of a decrease in bone density as you'll see an increase with bisphosphonates. It's a dramatic decrease in bone density. Marked loss of cognitive function has been shown from acid blockers. Dramatic increases in mortality, and they are highly addictive. When you stop stomach acid, when you stop the acid blockers, you get rebound acid, you get Niagara Falls of stomach acid. Your stomach aspirin levels, the blood gastrin is going way high, and you get the Niagara Falls coming into your unprotected stomach, because those acid blockers were also knocking out your stomach's mucus lining at the same time. That's why if you just tell people to stop acid blockers, they will have heartburn from hell and they will come and hunt you down and kill you. That's not the way to do it. let them know about the dangers and that you're going to get them comfortably off of the acid blockers by optimizing digestion, optimizing the stomach's protective lining, and then they can wean off. So uh, outside of feeling miserable, what's the problem with poor upper digestion? Well, if you're not digesting your proteins down to their individual component amino acids, you're going to have a real problem, because you get part incompletely digested proteins getting presented to the gut lining for absorption. And if you have leaky gut, which we'll talk about in a minute, then you have incompletely digested proteins. You've got a mucus lining, or it's basically like an immigration barrier that's letting everything through. You know, the gut's supposed to say, here's what can come in, here's what can't. And you're getting, basically, it has no selection anymore. Then you get these strings of amino acids absorbed into the bloodstream, and your body will treat them as outside invaders. And that's what triggers the food sensitivities. We'll talk about that more in a moment. So when you take a look, there are three key areas that trigger the food sensitivities. Number one is incomplete digestion of proteins. Number two, leaky gut allowing those incompletely digested proteins in. And then inadequate adrenal function, which is what regulates immunity. Those three together are a perfect storm for food sensitivities. When you optimize digestion, and we'll talk about that in just a second, you're going to find that people's food sensitivities will go away, and we'll teach you how to handle all of that as well. So how do you get rid of the food sensitivities? We're going to teach you today. You've learned that you optimize stomach acid, digestive enzymes, and then to improve digestion. We'll talk about leaky gut in a moment. And that will prevent new food allergies. But two wonderful tricks for getting rid of old food sensitivities. One is an allergy elimination technique called NAET. That's non-Boudreaux allergy elimination technique. Uses muscle testing combined with acupressure. And it's a simple technique to learn. You can learn it in a weekend. And I remember the first time I heard about it, I had horrible ragweed allergy, hay fever kind of stuff, sniffling, sneezing, honking. I was basically miserable. And I was dating this gal who did NAET. And she said, let me get rid of your hay fever for you. And I, being the all-knowing physician, I said, that voodoo's not going to help me, leave me alone. And, one day she said, stop being a nitwit and let me treat you. 20 minutes later, my hay fever was gone. Never came back again. Very powerful but simple technique. Our foundation funded a study showing that it's very helpful for autism as well. Another technique is sublingual neutralization. Basically, these techniques help reset the body's immune system so that your body is no longer having sensitivities to things that are healthy for it. But again, once you eliminate the food sensitivities, if you don't fix the digestive, upper, lower digestive, and adrenal issues, they're going to come right back. So how do you optimize upper digestion? Very simple. Number one, chew your food. Number two, give plant-based digestive enzymes. Now, I'm going to stress the word plant-based because what we were taught in medical school was to give animal-based enzymes. And in over 30 years or 20 years of using them, I never saw one person get benefited from them. I gave them up. And then a chiropractor taught me that, no, you have to use plant-based enzymes because they work in a very wide pH range. So I started using plant-based enzymes, and the effects were near miraculous. People's digestion improved dramatically. So what you want to do is there's a product called GI Digest. It's all plant-based enzymes. It's outstanding. Have people take one with each meal, and they're going to see a marked improvement in their digestion, and they're going to see it very, very quickly. You want to add in whole fermented and raw foods, can help digestion. But again, no animal enzymes. Save animal enzymes for if you're treating an injury. You want to use just plant-based enzymes, so the GI Digest. And the other thing is enzymes work best at body temperature. If you're taking an iced drink, which is fine if your digestion is good, but if you're having indigestion, go with warm liquids, like a warm light tea kind of a thing, or just room temperature, so that you don't inactivate the enzymes in your body and present in the food. So, and then they can have the ice drinks again once the digestion is healed up. So again, step one, plant-based enzymes giving GI digest, one with each meal. Step two, not everybody will need this, but if the enzymes themselves don't do the job, and it's not unreasonable to start with both, give them betaine plus, which is basically a hydrochloric acid and pepsin. So these really add to the digestive process markedly. So go ahead with these, but you don't want to give it if they're having active ulcers, and tell them if it bothers your stomach that they're going to save that till later. They can also just use vinegar-based salad dressings, which will supply acid to help digest the food. So you have step two in taking care of upper digestion and optimizing upper digestive process, plant-based enzymes and the betaine plus. And then step three is the mucus lining of the stomach, which is so important. As we mentioned, as far as stomach acid is concerned, the stomach's just another piece of meat, and the acid and enzymes in your stomach will try to digest the stomach wall. And it would, except that the stomach is constantly pouring out a protective mucus lining between itself and the stomach acid. It makes about 1 liter of this protective mucus lining each day. And then the acid eats at the lining, but at the mucus layer instead of the stomach lining. And then it keeps putting out more of the mucus. So the stomach stays a happy camper. They're wonderful herbals and natural compounds for helping support and rejuvenate the mucus protective lining of the stomach. This is especially important after acid blockers, which turn off production not just of acid, but of that mucus lining as well. So you want to give mastic gum, which also helps restore the bacterial balance, healthy bacterial balance in the stomach, DGL licorice, marshmallow root, slippery elm. All of those together will restore the mucus lining. You want to give it about 6 weeks. So what I'll often do is have people take this, and instead of taking 8 different pills of 6 different products, it's just crazy. Just Pyloraplex, excellent combination of all of these. And they can take 2 capsules 3 times a day. Tell them to give that 6 weeks. That's how long it takes to restore the stomach lining. So 6, 8 weeks. Do it along with the digestive enzymes, maybe the betaine HCl. Then after 6 to 8 weeks on this program, their stomach is going to be starting to feel a lot better. Then you want to, at that point, have them start to lower the dose of the acid blocker they're on, if it's one of the proton pump inhibitors. And then they can usually pretty quickly from there switch to Tagamet or Zantac, because that will not turn off the acid, it'll just lower it. Much less addictive, much safer than the proton pump inhibitors, which are incredibly toxic. And then they can wean off of the Zantac or Tagamet, and suddenly they're off of all the acid blockers. It was a comfortable, easy experience. Their upper digestion feels great, and you will be their hero. So remember, 3 simple steps: plant-based digestive enzymes, a little bit of stomach acid maybe, and measures to restore the protective lining of the stomach. It really is that simple. And then wean off the acid blockers slowly, because otherwise you get rebound acid secretion. So let's take a look. You'll see that there's a new protocol called the Upper Digestive TuneUp protocol. You'll see a whole list of new protocols for the TuneUp Docs program that goes through each of the clinical objectives and the assessment. But again, that video, it's not going to take you more than an hour and a half, may just even take about an hour or so. That will really make you an expert. And Carla will give you information on how to watch that at your leisure. And it's going to send you a bunch of free patients as well. It's going to be a good referral source at no cost. So that's a gift from Douglas, but it's a gift to you and the people you treat predominantly. So we've talked about how to use the things in the new protocol here. One other area before we move to lower secretion, we've talked about digestion and upper digestive issues, but there's a secondary issue about what happens in terms of stomach acid getting where it doesn't belong while you're sleeping at nighttime. Because when we are upright, gravity keeps the acid in our stomach where it belongs. But when you lie down, that doesn't happen. And if that valve that keeps acid in the stomach isn't working right, that acid flows right up into the food pipe and burns the bejeebers out of it. And then it causes severe irritation during the day. So if they're having nighttime issues as well, it's really important to turn off the stomach acid at night and to heal that piece of the process too. Very often when you see severe chronic issues, it's because of that nighttime problem with the acid moving upstream. So here's a simple protocol. Um, you can also the Cures A to Z, CURES capital A-C phone app. It's a free phone app. It's like having my brain in your pocket, the short bullet points. So you could look up acid reflux or basically digestive issues nighttime on the app. And it'll talk about, so this is all there too, so you don't have to scribble frantically. You want to have people, during the day they need stomach acid, but at nighttime they don't. So you want to go ahead and neutralize stomach acid at bedtime. They can do this easily with 1/2 teaspoon of baking soda, like Arm & Hammer. I would put it in 3 to 4 ounces of water, and then they can just take it down like a shooter. Then they should take an ounce or 2 of water after that, rinse and swallow, because it's baking soda. It can be caustic, so you want to wash it all the way down at their stomach. The bigger the burp, the more acid they had that was just neutralized. That'll give them a 4-hour head start when they go to bed. If they have blood pressure issues, potassium bicarbonate instead, which potassium is important for healthy blood pressure. And you can get that, but not potassium carbonate, but potassium bicarbonate, same amounts. And you can find that on Amazon. Interesting, melatonin has been shown in several studies to keep stomach acid in the stomach where it belongs instead of going up into the food pipe at nighttime. Also, you want to get gravity in your favor. So you want to go ahead, they can get a sleep wedge pillow. They can find that at Hammacher, HAMMACHER.com, or they can put some bricks under the head of the bed. Just raise the head of the bed. It's not enough to raise your head. You have to raise from the waist up. And it doesn't take much of a tilt for gravity to get back in your favor. Be sure to have them take the GI Digest and 1 capsule an hour before bedtime so they complete the digestive process and the food moves downstream past the stomach by the time they go to bed. And this process for healing the nighttime issues takes about 2 to 3 months and can make a major difference. So the melatonin has been shown, again, number of studies. You can do a search on it. Many, there's a lot of benefits just from this simple melatonin at bedtime for that. So we talked about the upper digestive tract, give the GI Digest, give the betaine HCl, and then optimize the mucus lining. Those 3 simple steps will heal the upper digestive process and then wean off the acid blockers. Simple. And 3 simple steps, and people are going to love you. Now, let's take a look at optimizing the lower digestive tract. And the key things for that would be optimizing gut flora. That includes the optimal balance of bacterial, fungal flora, and then increasing fiber and water and healing the leaky gut. These are the key things. You'll see all these different things about all the stuff about lower digestion, but it really simplifies down to that. So why is our lower digestive tract in disarray? Well, we have, as I mentioned, 140 pounds of sugar per person per year added to our diet and food processing, which feeds yeast. And yeast grow by fermenting sugar, turning the colon and into a fermentation tank. And if you've ever seen a fermentation tank, it makes a lot of gas. And so do people who have candida imbalance. Meanwhile, we're giving antibiotics after antibiotics that kill off the healthy bacteria. And the acid blockers, usually it used to be an acid bath in the stomach. Most things that went through the stomach were killed. And because of that, that kept out bad bacteria. In fact, in most of human history, where our colon bacteria came from is we didn't have stomach acid when we were newborns. We would breastfeed, and our mother's milk would make a 10 trillion healthy bacteria in the colon. Then when we weaned, our stomach would start to make stomach acid, and that became a seal. And those healthy bacteria we had from our mother's milk would be there the rest of our life. They're old friends that we, had soon from birth, and they were with us forever, and their progeny. Now, they have mostly been destroyed because of all the bacteria we get and all the sugar. And now the gut is in disarray. So you want to take care of that. And it's not that hard to do. Again, there are normally 10 trillion healthy bacteria in the human colon, as many cells as there are in the whole human body. And many, many, many studies are showing that this microbacterial balance in the gut is critical for optimal immune function. And it's a matter not just of how many, but the diversity, because it's like any healthy culture is going to have a wide array of talents and diversity. And that's really the key thing that you want in there. On the other hand, more is not better. We're now having the probiotic wars out there where they're saying, well, I'm going to give you this many 100 billion and stuff. Here's a key point that most doctors don't know. The small intestine is supposed to be fairly sterile. If you have more than 10 to the sixth bacteria, in a loop, it's basically as sterile as the urine is supposed to be. And if you have more than that, your small intestine is going to be very unhappy and give you gas and other digestive symptoms. Now, here's a little pearl that you'll find invaluable. How do you tell if the gas is coming from imbalance of bacteria or candida or fungal stuff? And the way that you tell that is very simple. Bacteria split the sulfur bonds. And because of that, remember in grade school, there'd always be this one little kid who would pass gas, and all of a sudden, everybody in this class that knows, go, ooh, what's that? And then the little kid would turn around and smirk at everybody. And we called them silent but deadlies. When you have that sulfur smell to the flatus, you're talking about bacterial imbalance in the small intestine. When it doesn't have much of a smell, it's usually candida imbalance. And that's better than any test out there. I can give you a bunch of tests you can do. You can do hydrogen breath testing, you can do sulfur testing, hydrogen sulfide, all kinds of things. Do you have silent but deadlies? That will tell you whether you need to address bacterial balance as well. If you're giving more than 20 billion bacteria in a probiotic, you can trigger excessive bacteria in the small intestine and cause problems. I consider up to 20 billion at a time to be optimal. So, number one, if they have the silent but deadlies, then you want to rebalance the healthy bacteria in the gut. Now, again, you can do a hydrogen breath test, and they have 3 different ones. One is for bacterial balance, the other one would be for lactose digestion, and the other is fructose digestion. So get the one for the bacteria. But again, I just ask that one simple question, and the questionnaires that we can offer that will help you do a tune-up really quickly, because it'll elicit all the questions and then put together, here's what people need. You'll know in 1 second, you can look at it and tell if they've got this. It's that simple. Ultra MFP Forte is amazing for this, and people will see it because they'll see that silent but deadly smell goes away. It's a mix of a number of things, including grapefruit seed extract, olive leaf, berberine, burdock, golden seal, and black walnut. This is one of my favorites. Have people take 2 capsules twice a day for 1 month. That'll usually take care of it. And then they'll tell if the problem's coming back because their symptoms and that rotten egg smell, the silent but deadly will come back, and they can just take it as needed. If you see that they continue to have this coming back, you want to look at thyroid function, because the way that the small intestine keeps itself clean is by washing everything downstream into the large intestine, where you want it to be kind of murky and full of bacteria. When you have sluggish movement, you're going to see that you get backwash of the bacteria into the intestine and into the small intestine. So optimize thyroid function as well. Yeast imbalance, again, if you have the flatulence, upper respiratory infections, the best symptoms besides the gas, bloating, diarrhea, constipation is people have nasal or sinus issues. That is candida yeast imbalance, and that needs to be addressed. What do we do medically? We give antibiotics for the sinus issues, which make the problem worse in the long term, which is why acute problems become chronic. So very simple protocol for optimizing healthy intestinal balance. Number one is Capralex. It's a wonderful caprylic acid. If you give most people most caprylic acids, they're going to be burping up in the caprylic acid taste all day, and they're going to hate you. You want to give the Capralex, which is a 400 milligram buffered caprylic acid. It's a controlled time release, so you don't get the stomach things. I know when I took regular caprylic acid, oh, it was miserable. Capralex, don't even notice it. You want to have them take 2 a day. And then the multiprobiotic 40 billion has 20 billion per capsule. So 40 isn't 2 billion. So just have them take 1 capsule a day for 3 months. Then they can drop it to every Monday, Wednesday, and Friday and maintain the same benefit. The Capralex, usually I'm going to give that for several months. I'll give that for 4 to 6 months because it takes a longer time to rebalance the fungal balance in the gut. So this is going to optimize sluggish bowels as well, but increase fiber and magnesium, optimize thyroid functions. But when you balance the bacteria, you're going to find that very often the constipation and sluggish bowels are gone as well. A few other considerations that you already know. Avoid unnecessary antibiotics, avoid sugar, avoid the arthritis NSAID medications. These are a major contributor causing the leaky gut. So you have that incomplete digestion of proteins, a leaky gut barrier. You say, hey, that's like an invitation to food allergies. You can use the natural herbal things instead of the NSAIDs. There's all kinds of wonderful things that you can use to optimize joint health. We talk about that in the TuneUp Docs program as well. L-glutamine is the only food that the intestinal lining can use. So you can give L-glutamine and the fructooligosaccharides as a prebiotic in a powder, and that also will help with the healing of the gut lining. So 1 teaspoon mixed in water once or twice a day. So this is basically summarized in the lower digestive tune-up protocol. But the bottom line, if they have a lot of gas, bloating, diarrhea, constipation, ask one simple question. When you pass gas, does it have a sulfur, silent but deadly smell? If yes, go with the Ultra MFP Forte, 2 twice a day. With meals is optional, but can be with meals. Give it 1 month. If the problem persists, you may find the sulfur smell goes away, but then they still have the gas bloating. Then they need to address candida as well. And you do that with the Capralex, 2 tablets a day. Meanwhile, give one of the multi-probiotic 40 billion a day. And then berberine also really helps balance both bacteria and the fungal, and that's 1 twice a day. So that can be added for additional support. So let's wrap up. To optimize energy, Ultra Preventive X is a very good multivitamin. Ribose or Corvalin, our research showed that you increase energy production 61% after 3 weeks by giving 5 grams 2 to 3 times a day. I would give it morning and lunchtime. Ubiquinol for the coenzyme Q10, methyl B12. If ferritin levels are under 60, again, the normal range says if the ferritin's over 12, the iron's normal. Researchers have described that as, quote, insane. If the ferritin level is under 60, you want to give them iron. the ferritinal iron, 2 tablets at bedtime, away from thyroid. So if giving thyroid in the morning, give that at bedtime. And interestingly, magnesium potassium complex, 2 tablets twice a day after 4 to 6 weeks, can markedly improve energy. So we've talked about improving energy by improving digestion and taking care of food sensitivities at the same time, major issues, and taking care of gut infections that are a major drag on, or taking care of optimizing balance of bacteria and fungi. So optimizing those levels in the gut are major for optimizing energy, and then these other nutrients as well. So to access the TuneUp Docs online, again, you're going to find it's a wonderful thing. It's not going to take you very long. You'll do the video. You'll be an expert on optimizing these 10 key areas of health and vitality. You'll be able to get people sent to you for free. You'll be put on their referral list once you finish the program. Then you can have your name added to the list. You're going to find that it will summarize what normally would have taken weeks of training in different things to get the same information. I tend to be a science geek. In creating these programs, we've summarized thousands of studies into a nice, simple, here's how. So I thank you all for joining us today. I thank you to the new paradigm of tune-ups instead of checkups. And, health is available. Vitality can be available for everyone. And thank you for helping everybody to get there. I'm here. I'm happy to take any questions that anybody has. Carla?
Yeah, thank you so much for joining us and for giving us all this information about TuneUp and a wonderful presentation on just the digestion factors that are so important. Today's presentation was just a glimpse of the helpful tools that we have available now, and that's just launched today on the website douglaslabs.com. The Dr. Teitelbaum developed 10-point optimization approach will help walk you through step-by-step how to give your patients a tune-up rather than checkup. And the program also includes printable protocols with assessment points and supplement regimens and recommendations that accompany the video series for each optimization point to put it all together for you. So you can find the program details under the Foundation section of our website, and we'll also be sharing the link to this new program with you via email following the webinar. So let's go to some questions that we have from the participants in the GoToWebinar box. So the first one is, I know that you mentioned the hydrogen breath test. Are there any other gut dysbiosis laboratory tests that you are in favor of, that you've used before, that also give you an indication that there might be some gut dysbiosis?
Well, again, looking at clinical signs and symptoms is really the best way to assess whether there's optimal balance in the gut. And there are many, many tests out there. And the only ones that I really use, outside of a stool test for Clostridia difficile and those kind of cases are suspected, would be there are several labs. Standard labs are useless for parasite testing, but there are several such as Geneva Diagnostics, Doctors Data, Parasitology Center. Those are the main 4 that I will use to do stool for O and P, because I actually know what they're about with it. Geneva will do a bacterial. They have this whole thing where they're looking at all of the different things. I think it's fascinating and useless. I shouldn't say useless, but I don't think it really helps that much at this point. I think right now just a simple culture and sensitivity, looking for things that are possibly pathogenic, is those are the 2 that I use. So the parasites, the fungal testing is useless. The way that I will test for fungus is, do they have gas, bloating, diarrhea, constipation? Do they have nasal congestion, sinus congestion, postnasal drip? That's how I tell. And then I will go ahead and treat to rebalance candida and optimize that, and then the symptoms go away, and that's what's diagnostic. But I can give you $50,000 in other tests that I wouldn't waste my time with. I just ask the person; they'll tell you. It's the art of. It's funny. The art of medicine is getting lost. We don't trust our own ability to listen and for the person to tell us, and that's problematic. Instead, we want things in black and white because we don't trust our art of medicine skills. It's not hard here. Do you have silent but deadlies? Do you have gas, bloating, diarrhea, constipation? Do you have sinus issues? Do you have symptoms of burning solar plexus or under the sternum? Bingo. I would put those simple questions against every single other stool test out there in terms of value. How's that for a new
Great.
commentary? Because everybody's out there trying to sell you, do my test. And I'm saying,
Yeah.
I'm trying to sell you, listen to the person who's sitting in front of you. The person
Mhm.
you're treating will tell you. Just no need to know
Yeah.
what to ask.
Yeah. Yeah. Asking the right questions. You're right. The next question is, what if you take, you go through this regimen and you notice maybe some nausea? I mean, are there certain times of the day, specifically for the Caprolix and for the Ultra MPF Forte, do you want to take these with food, away from food? You know, what's the kind of secret behind those supplements?
The main thing is for most people, it doesn't make a whit of difference. But let them know that they can take it, the twice a day on the Ultra Forte, MFP Forte anytime. I would just put it by the toothbrush, do it morning and night. And the Caprolix, I would just put by the toothbrush and take it in the morning. But tell them if, however, you do get a sensitive stomach with it, nausea, anything else, then just take it with food. You want to keep regimens as simple as possible for people because otherwise their compliance will disappear. They can't do it. They don't want to spend, okay, here's 2 hours later, my next pills, and here's 4 hours later, and here's another handful of pills. That's a sucky thing to do to people. Keep it really simple. As much as possible, everything sitting by the toothbrush, they take it morning and night when they go to bed. For short periods, they can take the enzymes with meal, and they'll find that they feel so much better with the enzymes that they will be happy to remember to take them. They'll keep it in their purse or by the salt shaker or whatever on the table, and that becomes easy. They're just putting back in the food what should have been in the food in the first place with that. So, but otherwise, you want to keep things as simple as you can for folks. Keep the pill count down. So, things that are short term are short term, some things are needed long term. But what we're giving you today are things that instead of 6 different products for this mucus lining, all in one. So things are combined and simplified for people. And it's really important to simplify things. People want that, they need that.
Yeah, yeah, and that's why we have the tuna program now.
Indeed.
um, yeah, so the tuna program is a series of 10 different short videos, about 5 minutes each. The hormone section is a little bit longer. It's about 9 minutes in length. So these are really easily digestible, no pun intended, short videos, and we have them that available now on the website, so you can go check them out now. If anybody else has any questions that they would like to submit, please do so now. I've just been checking, and there does seem to be one more. Here we go. What about patients that react negatively to enzymes? Examples, they may cause insomnia.
Well, it's unusual to see insomnia unless they're getting, the problems with it irritating their stomach. The main culprit that irritates the stomach is the pepsin, basically the protein digesting enzymes. Because if they don't have the mucus lining, it'll digest your own stomach lining, and then they get irritated. So you can find the enzymes um, that will go ahead and be pepsin free. And in those cases, you want to leave off the betaine HCl, but use the plant-based enzyme we talked about because most people find that to be really gentle.
Okay, great. That looks like one more question came in. They're just asking where we can find the protocols on the Douglas website. And if you're on the Douglas website homepage, look under the blue box that says foundations in all of the different categories that we have products in. And under the foundations category on that homepage, on that landing page, you'll see a nice picture of Dr. T and a link to the protocols as well as the videos. So they're all there together for you to find very easily. And it should take you about 60 minutes to go through all of them. And then you can start to begin using the checklist and using the protocols on your own. You do have to have a Douglas account, I believe. And if you do not, I believe you'll get a prompt to enter in some information so that you can be that you can access these tools.
So Carla, how
All
do they
right.
find it again? They go to where on the website? So one more
Yes,
time for how to find the videos.
Sure. Yeah, you'll go to the Douglas Labs website, douglaslabs.com. And then on the home screen, you'll see a list of all the different categories of products that we have. So there will be hormone, foundation, digestion. The videos and all of this information on the TuneUp program is under the foundation tab. So you'll go to the foundation tab, click on that. You'll come to another page. That page will list different products, but in the right-hand side, right above where the product list begins, you'll see Dr. Teitelbaum. You'll see his protocols and webinar or video series listed at the top. So you can click on that, and then that will give you the access.
Now, since this just went up today, I'm not sure if they set up the thing to add your name after you do the video to be put on the free referral list. If for any reason if that's not up yet, once you've watched the videos, you can email me and write down this address. My personal email is fatigue, F-A-T-I-G-U-E, and then D-O-C, so fatigue doc, at gmail.com. Let me know that you did the video, and I will go ahead and put my webmaster in contact with you to make sure that your practice information is added to your referral list. We're starting now to get the TuneUp Docs program information out in the mass media. I'm frequently speaking with Reader's Digest, other major things, Women's World, and putting out this information to the public about it's time for a tune-up. So when they come and get information and they're saying, where do I find a doctor? And they click, give us your information after you've watched the videos, so your name can be added to that list and get free referrals.
That's great. That's another great bonus. One more question here. How does one incorporate, oh, I just lost it. One second. How does one incorporate this into, okay, they're asking where we can find okay. Do you need to be a doctor or physician to access the protocols? Not right now. I believe that you will be, you have free access. Sorry.
Yep. Most of these protocols can be done by health practitioners, even if they haven't had the wave of the magic wand of the AMA, stroked over their head. This is common sense stuff that people in the healing arts can apply. And this is for everybody who's been trained. So, and it's been geared to be that way.
Great. And then, this last question is the Genova Nutra-Eval test helpful for treating digestive issues, or I guess diagnosing?
They're a very good lab, very good people. What I find most helpful, but the only ones that I really do, is the over and parasite testing and the simple bacterial culture and sensitivity. All of the rest of the information I find I can get better by just asking the person, do you have these gut symptoms? Do you have silent but deadlies? So you can do a bunch of tests and hope that they point you in the right direction, or you can just ask the person. You can tell I'm a little curmudgeon when it comes to testing. The tests need to have proved themselves to be worthwhile to me. So many, many wonderful millions of dollars of good tests out there. I'm asking, is it going to change how I treat the person or how I help the person to optimize health. And if it doesn't, because I can get the same information from just asking them, I'm not going to do it. I'll let the person save the money for getting the tools they need to get well.
Yeah, that's fantastic. And definitely, as much, the more tools that we have and the number of tools as they grow, we don't want to lose sight of those important, clinical assessment and intuitive things that a practitioner has at their fingertips when they're right in front of the patient.
Yep.
So we do not have any more questions, and I think it was a great presentation. I think we had a lot of good questions and a lot of engagement. So everyone now, I hope, is rushing to the website to start looking over those videos and the protocols, and they have your information so they can reach out to you for more information. And with that, we're just upon the hour. So thank you again, everyone, for joining us today. Thank you. Many, many thanks, Dr. Teitelbaum, for being our expert on the topic of fatigue and joining us today. And with that, we'll end the webinar.
Be well, everybody.
Thank you. Goodbye.